Nappy rash. How do we prevent and treat nappy rash? So nappy rash is caused by sort of direct contact with urine and stool, so poos and wheeze in the nappy. Sometimes it can just be friction off the nappy, sort of chafing the skin that's underneath, or your baby may have like a yeast or a fungal infection. So ways that we'll prevent it, you can use a nappy rash sort of barrier cream. So we would usually recommend something that's like a zinc oxide based cream. So in the nursery we tend to use Sudocrem, and that tends to work really well. The best thing you can do for your baby is get to them quickly. So if they have soiled their nappy, the nappies these days are really, really good. The disposable nappies that are out there for drawing the urine away from the skin, but obviously stool's a little bit different. It does sort of sit there next to the skin. So if you know that your baby has had a bowel movement, then try and get that nappy off as soon as you can. We would usually recommend checking the nappy every sort of 2 to 3 hours. We in the nursery again would check our baby's nappy either before a feed, during, or after. So that's typically around about every 3 hours on average. If you can allow your baby to have some nappy off time, then that's great. So especially in the warmer weather, you can just pop a little change mat down on the floor, pop a towel on it, and just take their nappy off and let them have some movement. They can have some tummy time or whatever while they're down there. As long as they're not distressed, it's nice and warm in the room, then you can leave them with their nappy off for as long as you like, really. And that will just let the skin breathe. So obviously when they've got the nappy on, the skin's actually unable to breathe under there. So you can prevent nappy rash. Some people like to do it from the very beginning with a newborn. Others tend to wait till there might just be a little bit of redness developing and then they get onto it, starting the zinc-based cream. Totally up to you. If your baby is suffering with nappy rash that is ongoing, it looks very, very red and angry and the spots look wet or they're weeping, please do take your baby to a GP because you do need to find out whether this is a fungal sort of based rash, because if it's thrush or something like that, then your baby will need to have some treatment for that you can easily sort of get from your GP. So yep, that's nappy rash. So definitely as much nappy off time as possible will help your baby's skin to breathe.